Ultrasound is a useful tool to help you in determining the cause of shock, but it can be complicated and take time that is limited. With input from hundreds of ER and critical care physicians, we created Venue, a system that simplifies the complicated steps. Venue's Shock Toolkit is a set of features that focus on some key indicators of patient status: the heart, lungs, and IVC. It assists you in gaining insights needed to help in the determination of the cause of shock. You may want to know if the heart is pumping enough blood to end organs. When you use Venue and want to assess the VTI, find a 5 or 3-chamber view and press Auto VTI. If needed, optimize the position of the sample box over the left ventricular outflow track. With Auto VTI, Venue displays the Doppler signal automatically. The Auto VTI tool calculates the velocity time integral, or VTI, in a single step. The sample box changes colors, acting as a quality indicator to assist you with image acquisition. Without the Auto VTI tool, you would need to take several measurements and images to calculate the VTI. And if you want to see cardiac output, measure the LVOT diameter or simply type it in if already known. Venue will calculate the cardiac output for you. With VTI trending, you can trend your VTI calculations. This will allow you to quickly visualize the trend and determine your course of action. You may want to assess the respiratory variability of the IVC. The collapsibility index is a useful tool to evaluate the IVC, but taking all the measurements to perform and calculate the collapsibility index can take too much time. If you obtain the IVC view, Venue calculates the collapsibility index for you. Find the IVC, making sure the diaphragm is in view. Press the Auto IVC button. Venue searches for the appropriate place for you to measure the minimum and maximum IVC diameters within the breathing cycle. Not having to make manual measurements may save you multiple steps and time. You may want to check for B-lines to help confirm cardiogenic shock, or assess volume overload and pulmonary edema. Using Venue, find your standard view of the lung across the ribs or along the ribs, and select the lung segment in which you will scan. Press the Auto B-line tool. Venue highlights and counts B-lines in real time. Press Freeze, and Venue automatically searches and displays the frame with the highest B-line count, and saves it to the lung segment you were scanning. Without Auto B-line, it can be very time-consuming for you to scroll through all the frames to find the one showing the most B-lines and count them. Venue displays the B-line count upon hitting Freeze. Venue's automated lung tool helps you to quickly assess all segments of the lung and follow up on prior exams. If you survey the lungs, Venue can display a summary. Venue Ultrasound System, a system designed to help you quickly get the information you need to make fast decisions when triaging patients, including those in shock. Learn more at gehealthcare.com.